Joining us now is Dr. Daria Long, emergency room physician and clinical assistant professor at the University of Tennessee, and Bianna Golodryga, CNN senior global affairs analyst. Dr. Long, I want to start with you. From a medical perspective, from a public health perspective, what would ending social distancing in 10 days, say let's pick a number, what would that do to your battle against this pandemic?
Hi, John. Good morning. And you know what? I'm a mom of two. Ideally, I would love to see life to go back to normal, but let's think through that. In 7 days or 10 days, say we do end the social distancing. I want to know, as an emergency room doctor, would we suddenly have more PPE? Would these medications that we're talking about, Plaquenil and all these remdesivir that are on shortage, are they going to stop being in shortage? Are we going to miraculously have more ICU beds when we even know those ships won't be here in 2 weeks? Are all those things going to change in 7 days? Because if not, what's going to happen to the emergency rooms? What's going to happen to the hospitals? And the truth is, a pandemic, it's not like ordering it on Amazon Prime. I can't just solve it in 48 hours. This is going to take time.
How helpful has it been for you, Dr. Long, these last 8 days to have these measures in place, mostly across the country and specifically even more so in certain states?
So, John, we're still seeing a rising of cases, and it usually takes, as we have seen, from the time that you're infected, it takes 4 to 5 days for your symptoms, and then another 3 to 4 days for you to really get critically ill in those patients who do get critically ill. So we're not going to see necessarily the impact of closures until 9 or 10 days after we have closed. Then you hope you start to see some slowing of infections.
And you're looking at a chart right now of the death rate in the United States. You can see it's over 540 now, with 100 deaths yesterday alone, by far the largest number of dead in one day. Bianna Golodryga, you for a long time were a business reporter, and a great business reporter at that. You know that there are people now in the business community and economists saying, yes, we want to save lives, but the economic cost is too high, and you need to reassess how much of the economy you shut down. What's the calculation going on?
Well, look, you're never going to fix the economy without fixing what's ailing it. And in this situation, it's finding a vaccine or at least some treatment for the COVID virus before anything starts to reopen. And what's really frustrating about what the president is suggesting is that we're barely 2 weeks into this shutdown mode, into the social distancing. So it's sort of a worst case scenario to suddenly jumpstart it right now.
It really is just the beginning, which was why it was so surprising to me to hear the sudden shift in tone from the president over the last 24 hours. And not just a shift in tone in some cases, there was a shift in personnel. Dr. Anthony Fauci, the head infectious disease doctor in the country, wasn't beside the president yesterday during the briefing. Now, he hasn't been there every day, but he's been there many days. And listen to how the president responded to that, Bianna.
Where is Dr. Fauci right now? Why is he not at this briefing? Will he attend future ones?
I was just with him for a long time. And he's at the task force meeting right now. We have a task force meeting. He was there.
Does he agree with you about the need to reopen the economy soon?
Well, he doesn't not agree.
He doesn't not agree, Bianna, is pretty interesting language. But it's clear, let's just be clear about this. Public health officials in the government and public health officials around the country do not agree that it's time to end social distancing. But what's the impact of having this dichotomy, if you will, the economy versus medicine here? How will that affect this discussion going forward, Bianna?
Well, look, it's a tale of two worlds if you really focus on what's happening specifically in the hardest hit states like New York and Washington, where you see these pressers from the governors desperate for more aid, talking about a crisis situation, calling at times for the National Guard to even come in. And then you have a president saying, listen, our numbers are very good compared to the rest of the world. I don't know what numbers he's talking about, because the numbers we're getting shows that the U.S. has the third highest cases out of all countries around the world, and that's likely to rise as more people are starting to get tested. So when people watch the president on television sort of play this down, once again compared to the flu or car accidents, it's really setting a bad example for the rest of the country.
And Dr. Long, just give us the raw facts, because you're seeing them every day. They're walking in to your hospital. What are you seeing? And if you can, also explain to me something we heard from Dr. Birx yesterday, which she talked about the attack rate in New York City, where 1 in 1,000 people, which is very high, testing positive now for coronavirus and maybe actually be under-measuring the number of cases.
John, I think you're exactly right. I think to your last point, we are under measuring. So Dr. Burke said 1 in 1,000 in New York City. And on the one hand, New York City is a very dense city. So we expect them to have potentially a higher disease burden because the disease can spread so quickly. On the other hand, when they say 28% of all of their tests are testing positive for COVID, for me, that was just a sign that there is so much they haven't even scratched the surface. And if you look at New York City compared to South Korea is 2.5 times the size of New York City. They tested 4 times as many people, which means that there are many, many, many people who have it that we're not finding out. And we may find out in 7 to 10 days if they start to get critical. So we just don't know where this curve is going to go. We need time. We need time to solve it.
And Dr. Long, just tell me, go ahead, Bianna. Go ahead.
I was going to say, if I could just jump in, because the president, and I get the frustration that the economy is really taking a big hit now, but we've passed the time where we could just test people and keep the economy going. If we had started testing people as soon as the president, who keeps on congratulating himself for cutting off travel from China, if we started testing earlier then, maybe we could keep the economy open now. But I think what's really frustrating is that you're seeing the president say the economy can reopen in 2 days. You've got Congress fighting over a $2 trillion bailout package and rescue package. And that's really confusing, not only for Congress, but for the markets and for those watching at home.
Very quickly, Dr. Long, I just want to know when you think you will see the peak, if you're anywhere near the peak in your hospital yet.
I think we're seeing such a difference across the United States. Right now, New York's the epicenter, they're calling it, it's ahead, and then we're seeing it trickle down to other areas. I think the reality is we're also seeing bidding wars between states, between hospitals. Some hospitals that don't have money are going to be able to afford PPE and different things because the prices are rising. And I'm really concerned that some of the decisions are being made by those who know they have special access to things that the rest of the public and my patients are going to experience in shortage, John.
All right, Bianna Golodryga, Dr. Daria Long. Dr. Long, thank you. Long is saving lives.